Welcome to our Combating the Winter Blues at Vandy's Medical Center Senior Life Solutions webcast that we're giving today. I'm Jody Harms, the Program Director for Senior Life Solutions, and this is Mary Lemus, the Program Therapist. We're thrilled to be here today and to talk to you about this really important topic. So as far as what we're talking about, like I said, the winter blues, and our objectives for today that we're going through is I'm going to define the seasonal affective disorder, which a lot of people call SAD. Also summarize who's at risk for it, summarize signs and symptoms, and discuss ways to combat winter blues also. We're also going to talk about treatment options and what Senior Life Solutions is if you don't know, and ways we can help. As far as seasonal affective disorder, it's a form of depression that interferes with your day-to-day living. It happens more often. And what happens is it's more during the wintertime months. So it's not exactly during the summer, but it's often relieved in the spring and summer months because it's more sunny out. So that makes a difference. So the vitamin D is a big part of it, and being outside with the sunlight. People with seasonal affective disorder have a hard time adjusting the shortened amount of sunlight, like I said, during the winter months. Usually it can start as early as the beginning of October and last all the way through, which you wouldn't think it would last this long, until April. So that's a long time. And I mean, a lot of times we have a lot more sun even in March and April, but it just kind of depends on how our year's going. And some people, they can tell, like, boom, it's happening right away in October. And some people say, no, it didn't really hit me till mid-December or so. So everyone's a little different, just like everything that can happen to us. So it's not always the same. So that makes a big difference. But melatonin is a big part of it. And melatonin is produced as an increased level in the dark, which is increased in the wintertime months. And that's what causes our depression to increase. And that's with seasonal affective disorder also. So that's part of the reason why sunlight so much affects how we have seasonal affective disorder. Who's at risk? Well, of course, family history plays into everything that we have that goes on in our bodies. People that have seasonal affective disorder may be more likely to have relatives that are blood relatives who are closer to them that have seasonal affective disorder or another form of depression. Depression definitely runs in families, and once it's in your family, you're kind of stuck with it as far as that it can go on down the bloodline. So that's definitely something. Family history is a lot. We love it, but we don't like it a lot of times because of what else it can do with our bodies as far as relatives having something that we can get it. We're at an increased risk for it. And this is one of those many things. Having another mental health disorder definitely plays into it. So major depressive disorder or bipolar disorder, that's another thing. Symptoms of depression can worsen during these wintertime months, whether or not you have seasonal affective disorder. And the reason for that is just like the same way with seasonal affective disorder. You're not as much outside, you're not necessarily getting as much exercise. So that affects how we're feeling and can make our depression much worse. Of course, gender can play into it too. So us women, we're at a higher risk of developing seasonal affective disorder than men are. And also with that, we typically, women also are not outside with our jobs and our activities near as often as men are. So that's part of it too. And I know that's totally a gender thing, but it's true that we're more the caretakers a lot of times in our roles. 25% of the population does suffer from seasonal affective disorder to some degree, but at least 5% suffer from a greater form of this disorder and are severely affected from it. So it's a major thing. A lot of people think, oh, I just am not as happy during the winter months. That could be a sign that it's seasonal affective disorder, not just that you don't feel well, that you're noticing more than just not feeling the best. Some signs and symptoms of seasonal affective disorder: loss of interest in things that you previously enjoyed, feeling sadness that lasts longer than 2 weeks, or grief, loss of energy, feeling tired all the time, physical symptoms that can't be explained, like headaches, stomach aches, indigestion, constipation. And sometimes we think, oh, it's just I've got a little touch of the bug, that maybe I've got the stomach flu or something like that, but it could be a lot more than that. Feelings of worthlessness, guilty feelings, and hopelessness. Those are things that don't seem to get better during this time period too. Not being able to think or feel as clear mentally. And with that thought in mind, it could be just that your mind is easily going blank and you're like, gosh, I'm really trying here, but there's nothing coming to me about things. So it's more than just like, I went to the store for 3 things and I forgot 2 of them. That's not it. It's more that you can't concentrate. You can't come up with what you were trying to come up with. Unable to, or change in appetite could be that you're eating a lot more or a lot less, and that you really have to focus that, hey, it's breakfast time, I need to eat something. And hey, it's lunchtime, I need to eat something. Because you're really having such a lack or eating too much that hey, I need to stop, I've had plenty to eat, that you're really having to focus on what's going on with meals and with your appetite. And also changes in sleep pattern. Your sleep affects everything. Just like a car needs gas to run, we need sleep to be able to give us energy for the next day. If we don't have that, it can really affect us in lots and lots of ways. And definitely with seasonal affective disorder and depression in general, we don't get that rest. Wow, our attitude, our mind, our mental clarity, everything, our emotional status, just being able to function in general can definitely be affected. So it's definitely something, if your sleep's being affected for whatever it is, and even if you don't know what that is, that's something to definitely focus on and know, hey, something's going on. I really need to look at what's going on with me. Things to avoid when you do have seasonal affective disorder: drinking too much alcohol. Alcohol is definitely something that can make you feel, it's a depressive factor of having it. So when you do drink, it can make you feel more down. And definitely, if you're already having some form of depression, which, like with what we're talking about, seasonal affective disorder, can make it only worse. So we don't want that to happen. Isolating yourself, make sure you're reaching out to others around you, getting the help you need. Don't overdo it. It's okay to say no. You know, we always think during the wintertime and during the holidays that I need to say yes to everything and anything everyone asks of me. It's okay to not do that. And sometimes when we do give and take, or say we'll do everything under the sun or not do everything under the sun, that puts us in greater risk of depression, whether it's seasonal affective disorder or depression in general, because we're putting ourselves out too much and putting too much on our own plates to do. Being hard on yourself. You know, okay, so you did say no and you didn't do everything under the sun for the holiday season. That's okay. You don't need to be upset about that. Taking time for yourself is very important. We all make mistakes, and that's part of what every day is a new day to start over. So we need to be easy on ourselves. We're always very hypercritical of ourselves no matter what's going on. So we want to make sure that we give ourselves a break no matter what's happening.
Okay, thank you, Jody. And I'm going to talk about things now. Jody talked about exercise and sleep and doing things you enjoy and treatment, and I'm going to talk in more detail about that. So things to do. She mentioned exercise. Exercise is really important for, like you say, lots of reasons. And for depression, for seasonal affective disorder, it's really important. And you can try to do things to get your heart pumping, to stay in motion. Some examples might be water aerobics. I know with COVID that would be a challenge right now, but that's something if you enjoy, plan on getting in the water. Chair exercises, there's lots of videos, lots of things on YouTube, and to buy off of Amazon that have exercise routines in chairs, so it's a lot easier, a lot better for your joints. Walking, of course, is awesome. Walking does a lot for our bodies and our minds. So walking, even if it's 5 minutes at a time in your house, around your house, on commercial breaks when you're watching TV, things like that, it adds up and makes a difference. It doesn't need to be 30 minutes at one shot. It could be 5 minutes 2 or 3 times a day. So keep that in mind. Make it easy on yourself. And then the band exercises. The bands that stretch when you move, and the resistance is good. That develops muscle, helps your joints. You just have to be careful that you don't overdo it with those. And then Tai Chi is also something else that research has shown to help a lot with depression. And you can do very simple Tai Chi moves if you're not familiar with that. And again, it's on YouTube. You can buy videos of Tai Chi on Amazon or anywhere. Pick an easy DVD up at the library. But Tai Chi is also a really good, recommended, low-key exercise for movement, balance, mindfulness, keeping yourself in the present, which helps with depression. Jody also talked about good sleep. Good sleep hygiene is really important. And sleep hygiene is just basically developing a routine in the evenings that works for you to help you sleep better at night. And that could mean perhaps turning the TV off earlier, perhaps stopping the meal time before what, 7 or 8 o'clock at night maybe.
Typically.
Yeah. Not snacking late at night. It also talks about going to bed and waking up at the same time. So developing a routine that works for you Monday through Sunday. I mean, you're including weekends here. So your body gets into that routine, but also it expects to have that much sleep. That will help. And getting out in the sun, and Jody talked about getting more sun, the vitamin D, but getting some natural sunlight during the day helps with your sleep at night. Mm-hmm. Limit the caffeine. We talk about, caffeine for some of us makes us more hyper, keeps us going, but that can affect your sleep even later in the day. It talks about how caffeine can take up to 8 hours to wear off. Don't eat right before bed, like I said. Watch the late night snacking. If you want to have popcorn, maybe not do it at 10 o'clock, but at 7 o'clock. Okay. And napping. Napping is not a bad thing as long as it doesn't interfere with your sleep. And some of the folks that we have, that we talk to in our therapy and all, for some folks, napping doesn't affect their sleep at all. Others, it does. If they nap for a little bit in the afternoon, then they have a hard time sleeping at night. So one, figure that out for yourself. Get to know what works for you. And then two, respect that. So if napping in the afternoon feels good, but you know it'll keep you awake, try not to nap, or for 15 minutes. Okay. Another thing to do to help with seasonal affective disorder or even just depression is do something you enjoy. And I realize that when you're in a major depressive state, that sometimes you do lack interest in doing things that you normally enjoy. So this would take perhaps some time if you are depressed, but start somewhere. And some of the things that are encouraged are, of course, traveling, and nowadays safely. When you, and that could be locally, that could be go out and about in your own hometown or in your community. Go somewhere in Iowa to visit. If you choose to fly, do it safely. Okay. Spend time with family and friends, and that's great. And it may have to be more virtual, like on Facebook or FaceTime or some of those other technologies. Okay. And of course, reading. Reading is awesome, and reading is learning. And challenge your mind, challenge your brain. Think of something that you want to learn this month or learn this year. What's a new skill? What's a new idea for you? Use that. Get familiar with your library. I know in Webster City and in many communities, they have those library boxes on the side streets that I think you can just take those books and use them. And if you want to return them, you can. If not, an awesome way to get reading. Volunteering, great thing to do. Now, right now it's difficult with COVID, but volunteering even virtually or doing things at home to help another agency. Sewing masks, making masks is an awesome way to volunteer, to help out the hospital, to help out anybody in the community who needs them. And then, of course, music is a huge thing. Whether you listen to music to help you feel better, whether you create music, that's awesome too. So use music as your background noise to keep things calm. You can use it to get your mind off of depression, lift your mood. It can help you if you need to relax and be more meditative. So music is a wonderful thing. And if you can create it, that's even better. Okay. And then treatment options. One of the options discussed often is the light therapy. And Jody mentioned that again about getting out and getting some light. But in the wintertime, that's a challenge. And with SAD, light is obviously important. So one of the things to look at is a light therapy or getting a light box. And you can order those. I think we've had folks order them on Amazon.
Yeah.
And the important thing about that, though, is like with any therapy, talk to your doctor first, right?
Yeah.
So talk to your doctor, make sure it's appropriate for you to do light therapy per se. It's a few hours each day, sitting a little ways away from this light product.
It depends on what the doctor says, though, as far as what they recommend, because there's certain ones for different reasons.
Yeah,
as far as what they recommend.
Yeah, so talk to your doctor about that, but that is an option for some people. And then, of course, medication and therapy. Medication is important for depression, obviously. So whether you have you're in a depressive state, mood, and or you have seasonal affective disorder, talk to your doctor. And it can be your regular doctor, or it could be a mental health professional, wherever you see, but talk to them about it. Don't not talk about it. People don't get treated the way they need to be if they're not bringing that up. And let the doctor decide. Even if you're not sure, let the doctor help you decide that. And the therapy, of course, with our program, we do the intensive outpatient therapy. So we do group and individual to folks who come and go. Now we are, right now, virtual. So we are doing online or telehealth therapy through Zoom. And we do that for our group and individual therapies right now because of our concern for COVID, and we want people to stay safe and healthy. That hopefully will change down the road. We don't know when. So right now we are doing it online. It's going well. But therapy obviously is important. And of course, research has shown that medication and talk therapy is the best combination to get you well.
And once something you are realizing that you have some depression, it may be to the point where you need to be inpatient psychiatric unit 2 potentially. That's something you and your doctor can discuss if there's concerns and he or she says, hey, you know, I'm really concerned about your well-being, that maybe that is something that needs to go on too. But definitely reaching out, telling your loved ones, friends, hey, I'm having some problems here and, you know, I'm feeling really depressed, and not keeping it to yourself is very important to stay safe, and also to make sure that you, continue to be able to get the therapy and help that you need. As far as that goes, the next thing that needs to happen is that Senior Life Solutions, we want to talk about our program. Our program, Senior Life Solutions, is an intensive talk therapy program. And with that therapy, what we do is anyone can refer to our program, and it's all about helping people where they're at with what's going on with them. We help with people who are 65 and older. And as far as that goes, it's usually when they're dealing with the struggles and challenges that go on as we age. And that can be anything from a tiny bit of thing or a big thing. And it's usually with depression and anxiety related to aging, but it's also with anything that goes on. As we age, there's a lot of good times and there's a lot of bad times that go on. It's not, sometimes what we talk about is how it's kind of rusty at times when we age. You know, they say it's the golden years. Well, it's not always really as golden as we hoped it would be. A lot of changes that go on as we retire and as we change from working full time and our life purpose, that I always have to be at work by this time, that we can't always have that same life purpose. It's not the same anymore. Our family, our friends, they all change. Who we get along with, who we see regularly, it's not all the same anymore. So that makes a big challenge for people. And so what we do is we try to help them through some of those challenges, and as we age, some of our loved ones do pass away. And so those holes in our hearts that we feel because of the death of loved ones and or pets, it can be really difficult. And so with all those changes, or changes in moving even, or life changes with our health too, that can be really hard. So to help people through those, they come to us. And we love to be able to help anybody 65-ish and older. And I say that because it depends on where you're at in your life. Even a little younger than that, depending on what's going on, we want to be able to help assess you and see what's going on that we can help you. There's a lot of times that first person that they talk to is someone on our team. Typically it's me, I'm a nurse, and we have a good conversation. I like to see people in person if I can, but I want to keep you safe too, no matter who you are. And so I can also see you I can talk to you on the phone or do it virtually, just like we're doing this, and we can do a video call too, because we want to do it the best to keep you safe. With health concerns and everything else with COVID, unfortunately, we have to be very careful. And I want to keep you safe, want to keep myself safe too. So we will meet you in any avenue that we can to be able to see what next is possible as far as that goes. With that thought in mind, after we've met up, then what we do is see what options there are. We have group therapy, we have individual therapy. With that thought that we're helping you, we do both. So we have our meeting times are Monday, Wednesdays, and Fridays, and those are group therapy in the mornings. And then we also have individual therapy that helps you on a one-on-one basis with Mary, our therapist. My team members that we all are part of, as far as that goes, it's not just Mary and I. We also have Angie, who's also our office and patient coordinator, and then the medical director, who's our psychiatrist, Dr. Ramos. And he's from Mason City. He sees our patients at least monthly, but it could be every 2 weeks. So we're very, very, very thrilled to be able to have him as part of our wonderful team, that he can help too. And he helps to give the blessing of getting people into the program and to assess if there's more that needs to be done and or what else can help. So we also talk with your family provider. So whoever your PCP is, we always talk with them and be able to get them involved to let them know that, hey, we're getting you some help, and let them know if something would go on that, hey, you've done great, you're now graduating from the program, and we are able to refer you back to them. Now, we don't just keep you, we still want you to be in very close contact with your provider too, because they're very important to you. And we don't do all that kind of care, but we do nursing assessments on you and make sure that you're in the best shape possible. So if we see something that you haven't seen for a while, and we go, ooh, your blood pressure's running high, or ooh, you say you really don't feel well, and you've said that for a couple weeks or whatever the time period, that we can help get you back to your doctor quicker or your provider quicker to say, hey, there might be something going on with your patient. I think it'd be great if you see them in whatever platform or way that is necessary, because we don't want anything to happen to you. So it's an extra set of eyes. We're kind of like extended family that wants to help make you stay well. As we age, we want to make sure your quality of life is the way you want it. We want to keep you in the best shape possible and doing well no matter what's going on. So we want to be the extra support possible and help you in lots of different ways. And as your physical body is well, your mental health is well, and your emotional health as well, you'll feel well overall. So it's very important that we help overall. So it's not just one piece of the puzzle, it's the whole puzzle that we're working on. So just like when people say, oh, I just don't think I'm that bad yet. Well, if you were diagnosed with cancer tomorrow, you wouldn't wait 10 months to go get help, I hope. So it's the same idea. Anytime you have something going on with depression or anxiety or seasonal affective disorder, it's something you need to really focus on and be able to get some assistance when you need it. Not wait, because it's not going to get better until you start helping yourself and taking care of yourself by getting support. So we want you to see your family provider if that's who you first want to see, or you can always give us a call too. Our phone number to be able to give us a call would be 515-832-7813. And if that's too many numbers to remember, we can always, and they'll put it up with this link too, but you can also always call the hospital and say you want to talk to Senior Life Solutions. Now, as far as referring, you don't have to have your doctor refer you. You can refer yourself to our program, and or you can always refer a friend that you're concerned about. We want to help any and everyone that we can, and we want to be able to give you the support that you need. And if we think that, hey, you're doing really well, we'll let you know that too. But we always want to make sure we've got lots of tools that we use to assess you and help you to make sure you're on the right avenue to feel in the best possible. So no matter who it is, we want to see you doing well, no matter your age, and we want to make sure that you're in the best shape as far as that goes. So I appreciate you listening to us today about winter blues and seasonal affective disorder. If you have any questions or concerns, we would love to hear from you. Our phone number again is 515-832-7813. Please, if there's any questions, you can always give us a call or put them on there and we'll be able to get those answered. And also, if there's anyone you think that we could reach out to help support and assist, we'd love to talk to them also. Thank you again, Mary, for meeting today, and thank you for listening to us today. Have a wonderful rest of the day.